This is a circumferential abdominoplasty that was staged. We initially did the front, and then we came back and did the back and sides. It was done with VASER liposuction and Diastasis Recti repair. Prior to seeking abdominoplasty, the patient underwent liposuction of the abdomen and outer thighs by another surgeon. Although she was satisfied with the liposuction result, she experienced residual loose skin, which caused functional issues and discomfort, prompting her to seek surgical treatment. On my examination, I found that the patient had a significant loose skin in the anterior abdomen and back and thigh area. 4 centimeters diastasis recti was noticed on examination, primarily in the lower abdomen. So the plan was a two-stage circumferential abdominoplasty. The first stage included a full abdominoplasty, followed by a second stage back lipectomy to complete the circumferential procedure. The operations that I performed was, in the initial one, was a full abdominoplasty with VASER liposuction. We repaired the diastasis recti, which was 4 centimeters in total. Subsequently, about 6 months later, we did a back lipectomy.